I'm Cassandra and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. From the moment you step out of bed each day, your feet do a lot for you. The little choices you make, from the shoes you wear to the activities you choose to do, it all adds up. It's easy to forget that your feet are your body's foundation. They support your entire body and contribute to your balance, posture, spine alignment, and overall well-being. Odds are you take your feet for granted until they start to give you problems. An estimated 87% of people experience foot pain at some point in their lives. Left unaddressed, foot pain can keep you from doing the activities you love. Today, we'll learn about steps you can take to protect your feet and ankles, as well as foot and ankle care available through ThedaCare. Our guest today is Dr. Michael Kozanek, a foot and ankle surgeon with ThedaCare Orthopedic Care. Thank you so much for being with us.
Thank you for having me.
Okay, so to begin with, we're going to get to know Dr. Kozanek just a little bit better. As a foot and ankle surgeon, what kind of care do you provide? I'm sure it's a wide range, right?
Most of the problems that we see would be number one, injuries, and number two, degenerative conditions of the foot. So deformities ranging from bunions, post-traumatic deformities, flat feet, cave-of-varus foot, that's foot that has the high arches that's kind of rolling out, people walking more on the inside or the outside of the foot, that has exhausted the non-operative treatment options. That's when they come to see a surgeon.
Okay, so a wide range of care that
Very
you can
wide
provide.
range.
What are the most common ankle and foot injuries that you see?
I would say most commonly there would be ankle sprains and ankle fractures. Maybe in the younger, more active patient population, there would be the sprains. In the older segment or in the higher energy injuries, car accidents, falls, work injuries, that's when we tend to see the breaks.
What are some of the treatment that you can provide when it comes to maybe things that are more complex?
Surgery-wise, there would be deformity reconstructions. We have an excellent team, brand new hospital, ORs, excellent support staff to essentially tackle anything, any kind of deformity, any kind of limb reconstruction, whether it's post-traumatic or degenerative.
What are some of the signs for someone that it might be time to see a provider when they're experiencing foot or ankle pain?
I would say any kind of pain that's not going away, or if it's obviously a fresh injury, whether there's deformity, whether there is suspicion for fracture, or if you can walk and put weight on the foot.
Does that happen pretty often when somebody might come in and they might not know they even have a fracture or break?
Sometimes you see patients that have nerve damage or what we call neuropathy, most commonly from diabetes, or it could be from other neurological conditions, where they cannot feel their feet. So we have patients coming in that have been walking on their broken feet, broken legs for quite some time.
So it's not always obvious.
So then they present with the deformity or the bone making its way through the skin.
And like you said, you can provide that care for them.
Absolutely.
Choosing the right footwear can make all the difference, especially important in summer when we have more footwear choices. So, Dr. Kozanek, we are going to show you some pictures of celebrities and their footwear choices, and we would like you to comment about those and tell us what you think.
Sounds good.
Okay, first one here is Bradley Cooper wearing, highly popular, some flip-flops. Thoughts about those?
It's kind of like an old myth that flip-flops are bad for you.
Okay.
Because, it's a fall hazard.
Right.
But honestly, I'm not against them. They're breathable. They don't constrain the forefoot. So unless you're going on uneven surfaces or doing ground level walking, it's perfectly fine, especially in the hot days.
Oh, I love to hear that. As someone who lives in flip-flops, good choice, right?
Oh, yeah.
Okay, perfect. All right, next one here, we have Jennifer Lopez in a pretty tall pair of high heels. Thoughts, comments about some high heels?
Well, that's why we're in business. Very fashionable, obviously. They're not going away. As far as ergonomics and actually being good for the foot, it's not really a good choice. There's a lot of pressure on the forefoot. The heel's elevated. It alters your gait. It's a fall risk. They're narrow, so they can cause a lot of pain on the forefoot. And eventually, if you wear them long enough, frequently enough, the foot will take the shape of the shoe.
Oh, I mean, not to mention they're not very comfortable, right?
Oh, yeah.
Okay, so not very comfortable and probably not the best choice for foot, right?
I would agree.
All right, walking barefoot, we have Britney Spears. Lots of people probably do this in the summer, walk around barefoot. I know kids do this all the time, right? Good or bad?
It's good and bad. Obviously it's good for your posture, for your proprioception. You can feel what you're walking on. You're using all the muscles, but then you don't see what you're stepping on. So I'll probably use those flip-flops for this purpose.
Good idea. I'm always afraid to let our kids walk around barefoot because I think they're going to step on like a bee or something like that.
Oh, yeah.
Happens, right?
Happens.
Okay. Our next photo here is of Reese Witherspoon wearing tennis shoes, running shoes. Thoughts?
I think that's a great choice, especially for, running, jogging, if you have a longer distance walking to do, as long as they're not too narrow in the forefoot or if they're not obviously too worn down. They have nice support on the inside.
So good
it's
choice.
All about comfort.
Yeah.
Yeah, I think it's a good choice.
Okay, last one here. We have Taylor Swift in some pretty intense hiking boots.
I think that's a great choice, especially these shoes. They're supportive. They have good traction on the bottom. They go above the ankle, so they support the ankle. For hiking, I think it's a good choice.
All right. Thank you so much for talking through all these different shoe choices with us.
Thank you.
Let's close today with some tips. We're going to play a little game of Pictionary with Dr. Kozanek, who has 5 recommendations for us to keep our feet healthy. I'm going to try to guess what the recommendations are, and then you will explain. How does that sound?
Sounds good.
Okay, the first one here, I'm thinking, take a look at your feet, inspect your feet. Is that one right?
That's correct.
Okay.
That's correct. It's important to look at your feet daily, and it's especially true for patients that don't have normal sensation, normal feeling in the feet. So, patients with diabetes, neuropathy, nerve damage, because you can feel what you're stepping on, especially walking barefoot. And that could cause buildup of callus, eventually skin breakdown, and infections.
Okay, so keep an eye on those feet.
Yes.
Okay, our next one here, I thought this was spend a lot of money on shoes. I'm guessing that's probably not it. So probably buy good shoes, and then there's ruler for like measurement. Yep. Okay, what is this recommendation for?
So buy good size shoes, proper size shoes, making sure before you buy them, you try them out, walk for a little bit, make sure that they're not causing any pressure issues, that they fit you. The size of the foot changes throughout the day, and also there's a difference between sitting and standing. So make sure you take a few steps before you buy them.
Our next one here is, this is easy. Exercise, keep moving.
And this is kind of a generic advice. It's good for everything, cardiovascular health, mental health.
Okay, that's an easy one to remember, I think.
Easy one.
All right, our next one here, some stretching it looks like. Stretching of feet, probably toes as well. Okay, what does that do for us?
Very good. So stretching is very important. It's been shown to reduce the severity and incidence of heel pain, so plantar fasciitis, Achilles tendonitis, also shin splints. So stretching is good for a lot of different things, and we don't really do it enough. So calf stretches, toe stretches every day, I would say at least 3 times a day.
Oh, wow. Okay, got to remember to do that, don't we? All right, our last one here. Stop doing something. Pain here. Don't ignore foot pain, right?
Exactly.
Okay.
So if you have foot pain that's not going away, that's getting worse, it's affecting your everyday life, it's probably time to look at the source of it. Is it the shoe or is it something structural in the foot? If it's not the shoe, then maybe it's time to get it looked at and see us.
Thanks for providing these recommendations for us.
Thank you for having me.
And thank you for joining us for this step-by-step guide to keeping your feet and ankles safe and healthy. If you're experiencing a foot or ankle problem or any other kind of orthopedic injury or issue, ThedaCare Orthopedic Care is here to help. Visit ThedaCare.org/orthopedics to learn more or make an appointment. And for same-day care, available 7 days a week, visit our orthopedic walk-in care location in Appleton. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.